Okay, so the last section here, so we're going to cover the muscles. When we're looking at the chest cavity, you can see there's the ribs that are counted. We have external intercostal muscles and we have internal intercostal muscles. So you have a membrane that covers the outside. You have the transverse thoracic muscle, and you have the internal intercostal muscle and your external intercostal muscles. And it's hard to tell the difference, especially on CT, when you're looking at the rib. So you can see here where we have the carina, so that's right where the bifurcation of the trachea is. We have the pectoralis major and your pectoralis minor underneath. So here's your major and there's your minor. And we have the serratus posterior and your, sorry, my husband's making noise. So you have your trapezium in the back with your rhomboid and your intercostal muscle, so it's hard to see there, as you can see. Your serratus posterior superior, your serratus posterior inferior, and you have your levator muscles back posteriorly. So when we're looking at your splenius capitis muscle here and your rectus spinae muscle, here's your transverse spinous muscle, and your trapezius is back here. And your serratus muscle is right there, that little guy. So this is actually a picture looking at your diaphragm. So your diaphragm is large, as you know, and you can see you have a hole cut out for your inferior vena cava. You also have one for your esophagus, and they come down. Here's the hole for your aorta, and they come down and they attach to your spine. So it's called a crust. So you have your left crust and your right crust. Your right crust attaches lower than your left crust. So here's an axial Mri T1. So you can see your descending aorta, your inferior vena cava. Here's your right crust, and here is your left crust. So you can see them coming around. So that is actually part of your diaphragm. So here's your inferior vena cava, your descending aorta. Here's your left crust and your right crust. Looking here, you have your sternoclenoid mastoid muscle coming down and around, your infrahyoid muscle, you have your trapezius, you have your pectoralis major on the outside, so you can see it over here, and your minor on the inside, your latissimus dorsi muscle coming down and around, your anterior serratus muscle, and you can see your deltoid with your scalene muscles. So when we're looking here, we're going to start right here. So this is your right brachiocephalic vein with your right brachiocephalic artery with your left common carotid and your left subclavian artery. So your sternum is here. This is your pectoralis major, your pectoralis minor, and your teres minor or major muscle with your subscapularis. So here's your scapula. So subscapularis is the muscle that runs just underneath it. Your infraspinatus muscle, and you have your rectus spinae, your thoracic spine. This is the body. You have your trapezius is the one floating all the way posterior. Your serratus posterior, that one's hard to label, but you can see your intercostal muscles right in between each rib. Looking here, you have your pectoralis minor with your major. You got your scalene muscle with your subscapularis muscle, your supraspinatus muscle, your rectus spinae. Your rhomboid is right there, your levator scapulae. You've got your pectoralis minor and major with your clavicle. So let's take a look at the breasts. For you women, this should be super easy. For you men, you better study. So here's a basic layout of the breast. This is called the tail of Spence up top. You have your upper outer quadrant, your lower outer quadrant, your lower inner quadrant, and your upper inner quadrant. So here's a diagram of the breast. If we start up top, you have your clavicle, your pectoralis minor, and you have your intercostal muscles in between each rib. You need to know your pectoralis major, your retromammillary layer, your mammillary layer, which is your glandular tissue. You have your suspensory ligaments of Cooper and adipose tissue. Subcutaneous layer has your adipose tissue in it. So the glands come down to the latissimus duct, to the sinus, out to the nipple. So within the duct you have ductules and little glands in there called alveolus. Here's an MRI. This is a sagittal T1. So we're looking here at your pectoralis muscle, your retromammary layer. This is your mammillary layer, subq layer with your glands and your nipple. This is axial. You can see your retromammillary layer, your subq layer, and your glands. All right, so that was it for your lecture on the breast.